In today's complex healthcare landscape, it's important to know the difference between in-network and out-of-network in your health insurance. And why is that? Well, sometimes it can be pretty confusing, but it can mean the difference between a quality of care or increased costs that you have to pay if you are out of network. So that's what we're going to talk about today, the difference between in-network and out-of-network. My name's Holly Olson. I'm a board-certified patient advocate, and I am happy to take you through today when we talk about what the importance is of in-network and out-of-network, why it's important to know the difference, what is in-network, what is out-of-network, how you can be with your in-network providers, and we're going to level up at the very end and do some little higher level important things that you can do to improve your health care and spend less money. And here's our disclaimer. The information provided in this presentation is not professional medical advice. I'm not a diagnostic medical professional, nor am I your diagnostic medical professional. And this presentation is for informational purposes only. Please seek the advice of a diagnostic medical professional for all medical matters. A recent analysis of trends in medical billing, researchers found that 1 in 5 adults get a medical bill that's a lot more expensive than expected. 67% of adults aren't sure how they would pay for higher than expected medical bills, and the most common source of high medical bills are out-of-network charges. So what are in-network and out-of-network health insurance? What are in-network providers? In-network health insurance refers to a network of healthcare providers, including doctors, hospitals, clinics, and other medical facilities that have contracted with your insurance company to provide services at a pre-negotiated rate. These providers have agreed to accept the insurance company's payment terms and conditions, and this results in lower out-of-pocket costs for you as the insured individual. You also have a unique provider list. So these are physicians, hospitals, clinics who have agreed to a contract with the insurance company, and they belong to the in-network unique provider list. So if you have all these high quality providers that provide special pricing, they're on a unique list, what's the problem? Out-of-network health insurance involves healthcare providers who haven't established a contract with your insurance company, and visiting out-of-network providers may result in higher out-of-pocket costs for you because these providers can bill at their own rates, and that may be more than what your insurance plan covers. What can you do if you're in an emergency situation? Let's say you're out of town, you're on vacation, and you have an emergency. What are you going to do? These people are not in your network. So there is an emergency care disclaimer. And what this means is if you are on vacation, you're traveling for work, whatever, and you have an emergency, that emergency room, that facility, they cannot charge you any more than an in-network rate. So you are covered if there is an emergency and you are out of town, you are out of your network area. So you do have some protection there. So we know it's important to have an in-network provider. It can save you money. You have your known bills, your copays, you know what those are going to cost because you're in network. You also supposedly get a better, higher quality of care because these providers have been selected because of their high quality of service. The insurance company determines this quality based on patient surveys, based on other certifications that the physicians or the clinic or hospital may have. So those are advantages to having an in-network provider. So it's generally in your best interest to have an in-network provider. But how do you find an in-network provider? Well, first thing you need to do is review your health insurance plan documents. Now, lots of times this is a printed piece of paper. So make sure that that person that's printed on that paper, maybe that paper was printed 6 months ago, they may not be a in-network provider anymore. So it's on you to check and make sure. So the next place you would check then is your health insurance company website, or if they have an app, that would be great. You can look there, see if your healthcare provider, see if the hospital, see if the clinic, see if all those things line up and they are all still in network. And if you want to be 100% sure, go ahead and take the next step. Call the health insurance company. Confirm that the provider, that the facility, everything that you're going to use is in network. It is absolutely possible for you to go to a doctor who is in network, but if that doctor is providing a service in an out-of-network hospital, you can get hit with out-of-network hospital fees. So make sure that everything lines up and everybody is in your network. The other thing you can do is ask your actual healthcare provider for referrals. So let's say you go to your family doctor who is in your network and he wants to send you to a specialist. Well, make sure you tell your healthcare provider, I need to go to an in-network specialist. Can you please, when you make that referral, please send me to someone who is in my network. And last but not least, I want to take one more moment and help you level up your healthcare. So even between healthcare providers that are in network, their prices can be different dramatically. And you could be on the hook for that, depending on what your copay is, depending on what your deductible is. So it could be to your benefit to compare pricing between in-network providers and just see, maybe you can get a much better price from somebody else. Also, your health insurance company may have some price transparency tools. Often you'll find these online and they can help you gauge how much you would actually be paying to each provider. Also, offsite versus hospital costs. So when we say offsite, maybe a procedure can be done at a hospital and maybe it could also be done at a standalone clinic. So it's important for you to ask, first of all, like we talked about before, is the hospital or the clinic or both, are they in network? And secondly, is there a difference in price? Lots of times the hospital costs will be vastly higher than an offsite facility. So ask those questions. It can save you a lot of money in the long run. Next, get a cost estimate. You have the right to get a fair cost estimate for any procedure that you have. All you have to do is request that, and you are legally supposed to get that estimate. And lastly, consider telemedicine services. Sometimes, if you don't actually make a visit to the provider on site, the cost is a little less. Now, you have to be pretty discriminating about what you're going to go in for, what you're not going to go in for. So, take that with a grain of salt. You want to make sure that you're making the right decision for you. Alternatively, it could also save you time because these days, sometimes a lot of the specialists are far and few between. And if you have to drive a couple hours to see a specialist or visit via telemedicine, that could be a great option for you. It saves you time, it saves you money. Just think about opting for a telemedicine service. So I have a special gift for you today. I've got a free download. It's the medication toolkit, and you can find it at https://patientadvocateinfo.com/medication toolkit. I'll put that in the description below. This is a free download for you, helps you keep track of your medicine. Very handy to have. We would love to hear from you. Go ahead and send us an email at support@patientadvocateinfo.com. Visit us online at www.patientadvocateinfo.com.